Hello.
Hi, Prachi. Good evening. Sunny? Can you hear me?
Yes, I can hear you. Can you hear me?
Yeah, yeah, perfect. So, how do you
Good.
know?
Good. It's been a long time.
Yes, yes. Have you never been back to New Delhi after that?
No, and I plan to, I always say, "Oh, I'll be back soon," and then time goes by, but it was
Mhm.
always my plan whenever I return, I would come see you, but I haven't been back.
I know, I know. I was actually very keen to, since your mother came and
Yeah.
it brought back memories of the time you were in Delhi with me. So, I
Yeah,
would
yeah.
to talk to you on a Zoom call to check
Yeah.
up on exactly what was the year when you had come to me. I was just
I
trying
think
to.
it was the end of 2012. I think it was like October, November, December of
Okay.
2012.
Okay. And what
Yeah.
was the diagnosis of the doctors in US?
The doctor said I had permanent nerve damage. So I had been in a car accident and they have the
Okay.
airbag that open for
Yeah.
safety. So my airbag on the steering wheel didn't open. It was a fail safety feature. So my
Okay.
sternum and chest collided with the steering wheel. So they
Yeah.
said that caused initially hairline fractures and that pain would eventually go away. And then after a few months' time, which didn't happen. So
Mm-hmm.
it had been, and it was so severe that I couldn't lift my hand like this. I couldn't pick up
Mm-hmm.
a remote control, something even that light. I couldn't
Mm-hmm.
turn knobs, nothing. So it
Mm-hmm.
eventually got a little bit better to where I could hold things and move things, but the diagnosis ultimately was severe nerve damage, irreparable
Mm-hmm.
nerve.
Damage. Right.
So
Right. Right.
through like my torso, through my neck, through my upper
Mm.
back. Yeah.
Correct. 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 I remember now. And then, who was the doctor who was treating in the US? Was he a neurologist or was he an
I
orthopedic?
yeah, a neurologist. I went to eventually the last doctor was a neurologist who was also he's an Indian here in our community, so we knew him, so we trusted his diagnosis. So that was because I went to several different medical doctors,
Mhm.
but that was the final one. We asked him, "What is your opinion?" And that was his diagnosis.
Mhm.
So,
And
yeah,
if I remember correctly, how long were you with me for the treatment part?
about 3 months, 2 to 3
Month.
months.
And
Yeah, and I was
you have somebody in Delhi with whom you were staying, your Masi or
yes,
somebody?
yeah, my Masi, yeah,
Okay, that's good because you had somebody who was family in Delhi where you could stay
yeah,
back. Uh,
yes. So because I was coming to you almost daily, I think
yeah, I
three,
remember.
yeah,
6 days
four
a
times.
week or 5 days a week.
Yeah,
Yeah,
yeah.
yeah, I remember. And mom used to come along with you.
Mom was not there. No, it was
Masi
my
was
two
coming.
Masi. No, my other Masi came with me. So
Somebody
my
used to
Masi,
come with you. I remember.
yeah,
Yes.
yeah. So my Masi that lived in Delhi was there. So when I came to India, I flew to Mumbai first. So
Mhm.
my Masi in Mumbai traveled with me to New Delhi.
Okay.
So
Okay.
she
Oh,
made me, and she got some treatments from you also,
yeah, yeah, yeah.
which
Tell
I
me
think
one
now,
thing. Yeah.
yeah,
Yeah. Tell me, when did you start? When did you really think in terms of learning acupuncture? That was the most
that
interesting aspect.
that first needle. I tell the story all the time because people always ask, especially patients. So I always say I got in a car accident, same thing. The doctors here had no diagnosis for me. They had no help for me. So
Mm.
my Maki in New Delhi recommended, and then I say, I always knew I wanted a career helping others. I didn't know. I was waiting. What is it? I was waiting for the right fit. And I
Correct.
say from that, and I said I was willing to try anything because people here, Western culture, they're scared. Does it hurt? This and that.
Yeah, 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 yeah.
So they say, were you scared? I said, no, at that point, I was willing to try anything. It had been 2 years of this pain, but I
Correct.
didn't think about it very much. I've heard of acupuncture, but I didn't know anything about it. So I just went because I was willing to try. And I
Correct.
said, from the first needle he put in, I remember looking at the ceiling. And that
Mm.
first needle, I had this feeling and this voice almost that this is what you're supposed to do with your life. And
Correct.
that was so that
That's
that was the
great.
exact moment.
So immediately as you went back home, you decided to join course in acupuncture.
Yeah, actually, I started looking at schools while I was still in India. In the
Oh,
evenings, I
great.
would go to the internet cafe and research and everything. But when I got back, I didn't go immediately. I wish I regret it. But then you start thinking back and forth because here there aren't any schools near me. So the closest school was like 7, 8 hours away from here, from mom.
Okay, all
So
right.
that's why it
Where
took.
are you? Where are you staying now?
So I'm in Louisiana right now.
Louisiana.
So the
Okay.
closest school to Louisiana is Texas.
So you went to the college in Texas.
Yes. Yeah.
How long was
So
the course?
4 years.
4 years. Okay, it was a full-time course.
Yes. Full time.
So you stayed there only.
Yeah. So I lived there. So I moved there. Yeah.
And
And
which year did you get married?
I'm not married.
You're still single? Oh, that's great news.
That that
So
was part of the thing. I was like, if I move, if I don't, then it's going to change my whole life. I might not meet somebody. So that was part of it, that going
mm,
back to school in such a drastic way where I would have to move and live full time, that's a commitment.
correct, correct,
So
correct.
I didn't meet anybody in Texas. And then COVID happened, so I'm still
Yeah, yeah,
single.
so many things, so many things. And
Yeah.
now that you're a healer, I think your energy will also be much better because
Yeah.
your chi would be very positive.
Yes, exactly. It has to
That's
be.
very good. Yes. And what all type of problems are you treating mainly in your clinic?
So mainly right now I'm treating pain. I mean, that's the common one here. It's kind of it's not a good situation here as far as the healthcare industry goes. And so
Mm,
what has happened here is that the Western medicine has realized that at first they said acupuncture is fake, right?
mm,
For a long time.
mm, mhm,
And now they're saying, oh, it works, but only Western medical professionals should be able to
mm,
practice it. So then they started doing things like dry needling,
mm,
and so the problem that we're having is that
mm, mm,
health insurance doesn't cover acupuncture here. But
mm,
go to a chiropractor or a physical therapist or MD, and then
mm,
your insurance will be covered. So
mm.
it's a struggle happening right now that
But
we're,
you have a council. You have a council in Louisiana.
we don't, not in Louisiana. A lot of states do, but like Texas does. And so all the councils are fighting, but I mean, I don't know because, chiropractors and mental health professionals, they had to fight for the same thing to be recognized and to be given health insurance, to people to be covered by health insurance. But acupuncturists, it's just a struggle here because we're not very unified nationally. Some states
Mm,
have councils, some states don't.
mm,
And in the meantime, these other professions are stealing our medicine. I had a patient the other day,
mm,
very interested. She wanted to come for neck pain, and then I didn't hear from her. So I checked in, and she said, well, my doctor referred me to my physical therapist, and my physical
mm.
is dry needling and cupping. So I'm
That's
just going to
very
stay.
bad.
It's
That's very
very,
bad. But
very.
someone was telling me in the US, the acupuncturists, the association, they fought with the physiotherapists, and now dried needling is banned in the US.
Only in some state, only very few states.
So
So
that
I
means
think like New York,
something happened. Something
yeah,
did happen.
yeah, I think like New York banned it, and it was a huge win. But that's what I'm saying is that it's so divided. It should be national. That fight should be a national
Mm,
fight. It shouldn't be one
mm.
state here, one state here. That's silly. And then it's confusing for patients. Also, it's not a clear message.
But then
So
people are not ready to pay you privately because in Australia, I remember I had gone many years
yeah,
ago. My sister is there. I remember most of the people would pay private from the cash
yeah.
and then
So
get it
that
done.
is right. So that is what I'm doing. So yes, but it's just harder that way. It's longer. So so to answer your question, my patients mostly right now are pain, some GI issues, but I kind of want to go more into
You don't get
like
functional patients. You don't get emotional issues and all. I treat a
that's
lot of
exactly I want to
insomnia
go
and sleep issues. Yeah.
Yeah, so I'm gonna try to focus my advertising more on like depression, anxiety,
Yeah,
insomnia. I
yeah,
think,
correct,
you know,
correct, correct. That
because
is the
pain,
area where you should be working. Yeah,
you think so too?
yeah.
Yeah.
You see, stress is the biggest killer today. So
Right.
if we look at methods which are available, there's hardly anything in Western medicine. I'm a Western
Right.
medicine doctor myself. So there's
Right.
hardly
Right.
anything in Western medicine. So I think it is very important and pertinent for you to be able to push yourselves into this area. And how are you continuing with your CMEs? Do you attend conferences and all?
I've done a couple of online conferences. Here it's a little easier for those. You can do a lot of online courses and then you just get, so I've been doing that, just taking online courses. So like one thing I started doing, because I was also thinking about things that people would be willing to pay outside of health insurance. So like
Mhm,
pain, they're going to go to these other practitioners, I've learned. But
mhm,
things like the depression, anxiety, stress, things like that. But so I started also doing microneedling, which is more cosmetic, just to
mhm.
have some cushion because people expect to pay out of pocket cash
Yeah, yeah,
practice.
yeah, yeah.
So I've gotten a lot of CEUs through the microneedling courses. And they're like the business side. So I'm doing most of my CUs online.
I will suggest you two very good important things which
Yeah.
should help you boost your practice.
Yeah.
And because a lot of people are afraid of needles also. So one is
Yeah.
the Japanese therapy which I learned from a professor in Japan,
Yes.
Dr. Nagata, and this is known as PNST or prickling neurostimulation technique.
Mm-hmm.
And this
What
is
was
very, very effective. And I learned it from him only.
what is his name? No.
PNST, prickling neurostimulation technique. So what I'll
No.
do is I will send you a link. I
Okay.
have done a free webinar on this on the Net of Knowledge. So you know Net
Oh,
of Knowledge, it's a very
yeah.
famous online platform. So I
Yeah.
am I am a teacher there. Sunita is a teacher there. My son
Okay.
Sayan, who is an anesthetist, turned into acupuncture now. He
Good.
he also joined me. So
I
all three of
always
us are
tell
practicing.
when I tell my story, I always tell your story. I say, yeah, my acupuncturist in India was actually an MD and had really bad sinus issues. I tell them your story too.
Correct, correct. So
So,
I will suggest that is one thing. I'll send you
okay.
the link for that. You should have a look at it. And we
Okay.
have after that we did a 4.5 hours paid webinar also, which is available on Net of Knowledge. And then I have recently done a series of 4 webinars on laser. And this
Laser.
is a laser. This is a laser which I recently brought from France. This is a
Yeah.
company called Philatelic, which is manufacturing lasers. And this is a very high powered laser. And this is a pulsed laser. And it is very effective in acupuncture points. So a lot of
What is,
people who are needle apprehensive, I will
yeah.
suggest strongly that you go for laser therapy. So these two things I will strongly suggest will help you boost your practice very much.
What is the name of the French company?
Sedatilec. Sedatelec. Sedatilec.
Okay. Okay.
Right?
Yeah, that's yeah.
So
So that
I was very keen to let you know about these two techniques because I plan to be doing a series of travel abroad to be
mhm.
promoting PNST because the professor who taught me, he has given me the rights to promote it globally. So
Oh,
now I'm
okay.
planning to start traveling now,
Yeah.
and I will be coming to US also. Whenever I
Okay.
do plan, I'll let you know.
Yeah, I know
So,
mom because what I do LED therapy, like phototherapy for people that are
mm,
afraid of the needles. But I know when my mom came back, she showed me and she mentioned you did a different technique on her.
yes, yes,
Oh, yeah.
correct.
Do you
So,
know
so
when
I
you're going to be
So
traveling?
I will write down. I will let you know the travel dates in any case, and I will send you both the links so you have a
Okay.
link. Look at it, right? And
Okay.
thank you very much for the interaction. Bye
Yes, of
bye.
course. Lovely seeing you.
Bye bye.
Bye.
Bye.